Okay, for me, you can welcome the people.
Okay. Good evening, everyone. Good afternoon. Good morning, wherever you're joining us from. This is another segment of Ask the Pediatricians Live. Again, time for you to come and ask all your child-related questions. And our CEO here, Dr. Gbemisola Boyede, is here to answer all your questions in the next 1 hour thereabouts. So welcome to another segment. And please don't be selfish. Call your sister, call your neighbor, call your auntie, call your friend, call the grandmas. We need them here today. They need these shows, like just the way you need it. So call everybody to join us today for this show, for this program. You can watch us from Facebook. You can watch us on Instagram and also YouTube to ask all your questions, and they will be promptly answered by our CEO, no other person than Dr. Gbemisola Boyede. Good evening, ma.
Hi, good evening. Good evening, everybody. Good evening, Fumi. Good evening, everybody, wherever you're watching me from, on Facebook, on YouTube, on Instagram. You're all welcome to Atp Live. Thank you so much for joining us. I hope you can hear me, and I hope you can hear Fumi. Fumi, your voice is a little bit husky. Maybe you can, I don't know whether. Anyway, but we'll see how it goes.
Sorry.
Yeah. Okay. But yeah, we'll just see how much we can. So please try to ask your question on time so that we can get it done. And we have just an hour, hopefully. Let me try and so that I can pin it on the Facebook group as well so that people can see. So you're welcome, everybody. I can see a few people on Instagram. Welcome. See, so just go ahead. If you have any child health questions, go ahead and drop your questions and we'll try and answer them as soon as we can. Thank you so much for joining us. And please share the video. Invite family, invite friends. Okay, and let me just share to another group. No. We don't have any question yet. Okay, so
no, we don't have any question yet.
So welcome everybody.
Yeah, we are waiting. Okay, we have a question now.
Just a minute.
Okay.
Just a minute. Let me just make sure we pin it for those on our. Okay, yes, I've sent it now. So let me pin it to the announcements. Okay, so we can start now. Into the top. Yeah.
Okay.
Okay, yeah, I think we can start. I think it's pinned now and everybody, yeah, so we can start now. So please, if you have questions, feel free to drop your question. I hope you can hear me right.
Okay.
If you can hear me, let me know. If the volume is okay, Facebook, Instagram, let me know. So that we can make sure that we are putting it in the right way. To get my laptop charger. Okay, so for me, you can go ahead. Okay, you want me to approve the question? So we have one question on.
Okay, the first question. We have one question on Facebook now from Endalin Ifem. Does glucose cure a newborn jaundice?
Okay, does glucose cause any newborn jaundice? Okay, that's a very lovely question to have asked, because glucose does not cure newborn jaundice. I know many people when their children have jaundice, you start giving them glucose water. In fact, actually, glucose water can make your baby to have jaundice because when you give glucose water instead of milk, there's one of the mechanisms by which jaundice occurs is the fact that there's some stool inside the baby's stomach, what we call meconium, that black stool that baby normally pass in the first day of life. They need to pass it out. If it's not being passed out, then it's part of those stools can be broken down into bilirubin as well, and it will keep circulating in the baby's blood, and that will make them to even have more jaundice. So it is important that babies are fed and not fed with glucose water. They must be fed with milk. It must be breast milk, preferably. But if for any reason, for whatever reason, a mother's breast milk is not available, then the next best thing is to use age appropriate formula, but never glucose water. This habit of practice where when a baby is born, the first thing people want to give them is water or glucose water is a very, very wrong practice. It should never be done. Every baby must be fed with breast milk, preferably within the first 1 hour of life, and that is what is good. And it's actually better that way than for you to give them glucose water because that will cause that will make the jaundice worse. So I hope that is clear for those who are asking. Thank you. Let's go on. I don't
Okay, and Darlene,
say
you have your answer there.
yeah. Let's go
Okay.
on.
Okay, so Onyechi Oyagbaji is asking, good evening, doctor. Good evening, Onyechi. Please, how many meals of water should a 7 month baby take in a day?
Okay, thank you so much, Onyechi, for your question. So there's a way by which we calculate the amount of fluid. We call it fluid, which includes both water and milk, everything together. So it depends on the weight of the child. So each child has a amount of fluid the child should take every day based on the weight of the child. And that is what matters. So if your baby is taking milk, because for example, your baby is on breast milk, most of that breast milk is water, is 70 to 80% water. So for example, a 7 kg baby should be weighing about let's say 8 kilos. So with that 8 kilos, that means that all the fluid baby should take in a day at least must be at least 800 mils, and this include the milk and all that. So you still give your normal breast milk, and then when you're feeding your baby, you can give water. Usually, for example, with every feed, you can give about maybe 50 to 100 mils of water, and you can also let the baby drink water throughout the day. So there's no hard and fast. Even if your baby take extra water than normal, the baby can pass it out. What we worry about is dehydration if your baby is not taking enough water. And luckily, that is why we have what we call a test mechanism. So God already knows that some of us will not remember to drink enough water. So that is why you get testing. And that's why you go and drink water so that you can fill up your water. So most time babies will just take water by themselves or they will drink milk and that way they will have enough. But as long as you are taking both milk, water all together is about 800 mils thereabouts averagely. That will be fine for your baby, but it depends on the weight of your baby. So that 800 mils is based on my estimation of your baby weighing 8 kg, but your baby may weigh more, so you may drink more water. But just let them drink water and spread throughout the day. Not that they have to drink all at once. So a little sip here and there, but spread throughout the day is a better way of taking the water. Okay.
Okay. Onyechi, I hope you have the answer now. Now we move over to Samuel. Okay. And Darlene, Ifen, thank you. Yeah, we are glad it could help. Samuel Chidera. Okay, this is like a 3-in-1 question.
So please try and answer one question. Just sort of try and answer one question at a time, Samuel Chidera. Don't put 3 or 4 questions because by the time we finish answering one, we have forgotten to go back to the next one. So try and ask. You can put each of them as a separate comment, then we can take them one after the other instead of putting 3 comments in one block because we still need to answer each of them one after the other. So it's better to take one at a time. All right. Shemilori, bring my charger.
Okay. The first one. My son of 5 months is having catarrh and cough. I once had it, preferably. He contacted it from me. Please, what should I do to remedy it? That's the first question.
Okay, so first question, cough and catarrh. You also have catarrh yourself. So when you are breastfeeding and you have catarrh, try and cover your nose, use face masks. At least COVID has taught us that. Now everybody knows that. Just a minute, I need to put in my laptop charger. Okay, thank you. So COVID has taught us that. So most cough and catarrh in children are actually viruses due to virus. If your child is not having fever, your child is not breathing fast, it's most likely a viral infection, which means it will clear by itself. You don't need to give anything. So just keep breastfeeding exclusively. And that's what we recommend. If the baby's nose is blocked, you can use things like saline drops to soften the mucus so that the mucus can flow out. It's not a magical thing. It's not as if it's going to cure the catarrh. It's just to relieve that block nose to make the thing flow out. So that is what we recommend at that age. So that's
okay.
question.
The second question: lying down to breastfeed, does it have any side effect on the child?
There's nothing wrong with lying down to breastfeed. It's just one of the positioning for breastfeeding. There are many ways to breastfeed. You can sit up to breastfeed. You can lie down to breastfeed. You can breastfeed even twins in a way that you put them on one side and all that. So there's no way you could. But one thing I'll say about lying down is that you really need to know how to do it. It's a technique, because some people don't know how to do it. Because if you are breastfeeding lying down and you are blocking your baby's nose with the breast, then you're causing more harm to the baby. So you really need to make sure that there's a way to position that baby as you're lying down, that the breast is in the mouth and it is not blocking the nostrils. So you really need to know if. So some people are not very comfortable. They don't know how to do that. If you are not sure of how to do it, then just sit up and breastfeed your baby. Just make sure you have some pillow at your back, on your bed, and breast. But if you are usually it's easier with the older children, because the older children on their own, they can actually locate the breast even when you're sleeping and attach themselves and they're sucking and they're fine. But if you are not comfortable with it, just do whatever is comfortable with you. But it's possible to breastfeed lying down, and it does not cause ear infection. It does not cause milk to enter the ears or any of those myths. It's only if you are not doing it properly that you can run into difficulties. And most of the difficulties, if you are blocking the breast with the nose, or you are allowing the milk. Some of you will put the milk in the mouth, in the nose as well, because you are sleepy and you are not even taking notes. So if you don't know how to do it, don't do it. If you know how to do it, then you can do it properly.
Okay, now the last question from Chidera. What should be the normal weight of a baby boy of 6 months? His birth weight is 4 kg.
Okay, so there's an average weight. There's nothing like a normal weight. All of us are not like, your baby is weighing 4 kilos at birth, so maybe don't weigh 4 kilos at birth, so maybe weigh 2.5, or maybe weigh 3 kilos. So there's an average range of what is normal for every child. So as long as it's within the average range, then that is fine. So if your baby is 5 months, I think, but if you are not asking about 6 months old, I guess you are asking ahead of when you get to 6 months. So if your baby is so there are different formulas by which we calculate the weight of a baby. So most of you have your immunization card. If you go to your immunization card, there's a page there that has weights, and you have the weights on one side on the vertical axis, if you still remember your mass, and you have the age on the horizontal level. So you can now trace it, and you have some lines in there. So there are like about, some of them will have like 2 lines, some of them will have 3 lines, some of them will have 1 line. But the most important thing is that your baby must not be, usually most of them have 3 lines. So we have what we call the lowest possible weight, and we have the highest possible weight, which is the upper line. Then the one in the middle is the 50th, which is the average. So if your baby is in between those 2-3 lines, as long as your baby is not at the upper part of above the line or lower part below the line, that is fine. Second option is for you to calculate, to estimate. So for example, we will say we have some formula we use. So if your baby, for example, is 6 months old, we will add 9 and divide it by 2, and we'll say your baby should be weighing averagely 7.5 kilos, which is okay. Or you can just, there are a lot of these days, all of us have apps. There are a lot of apps. Just put in the weights of your baby's age inside there, and it will tell you the the average weight of your baby should be. But the reason why I'm saying all this is because sometimes you may think, if for example I say your baby is should be weighing 7.5, your baby may be weighing 8 kg or 9 kg. Doesn't mean your baby's weight is abnormal. It may still be within normal because we have what we call the lower limits of normal, we have the upper limits of normal. So it will still be. So that's why it's important to know that there's a range. It is not like it has to be exactly one figure, And if your baby started very big, then your baby may be bigger than average weights of people that started at 2.5 or 3 kilos, So that's the most important thing. And averagely, most babies will gain like about 1 kilo every month, 30 grams per day. If your baby is a term baby and it's full time, so there are many ways that we should gauge it, but the best option is for you to plot it on that chart that is in your immunization card. Usually, the nurses always do it, and they make sure that your baby is still following his own line. As long as the baby is within his own line and it's not falling off either higher up or lower down the normal line, then we don't have any reason to worry. Okay, for me, I think let me just quickly go to my Instagram family.
Instagram, okay.
Start the question because if it's flying too high, I won't be able to scroll it up and down and say. Okay, thank you so much for those watching on Instagram. The question that's ready is scroll high up. That's what I was trying to say. I need to make sure I say I'll screen it now. Okay, so the first question is Udochi is asking, Doctor, good day, doctor, is 38 degrees temperature normal for a teaching child? She's 11 months old. Okay, so normal temperature is 36.5 to 37.4. So that is normal temperature. So most time you people don't have problem with lower temperature. So let's just not worry about the low. Let's just focus on the upper temperature. So anything above 37.5 is high. So 38 is high. And it has nothing to do with teething. What? I don't expect your baby to have fever because your baby is teething. So that's another thing most of us always think that, my baby is teething, then it's because of it's the teething that is making baby to have fever. Your baby does not have fever because of teething. The dentist will say the temperature may rise, really they may be warm, but it should not be no more than maybe 0.1 or point something degree, which means that it should never get to a fever level. So it will never get to 38. So if a child has fever of 38, that child has fever. So give paracetamol. And if the fever persists, you need to go to the hospital. It's very important that we say it because most of the time children are sick, but parents just assume it's a teething. And because of that, they don't seek help on time. And this is one of the reasons why some children die, because we don't seek help, because we are assuming. It is the most dangerous thing to do for children, to assume why the child is having fever. And please, teething does not make children sick. I think I can't say whether I said that 1 million times, but I'll keep saying it. Teething does not make your child sick. If your child is sick, please don't say it is teething. Take your child to the hospital, get your child treated. I can't count how many times children will come to the hospital very ill, sometimes almost dying, and then why didn't you come since how many days? Oh, they say it's teething, and I'm giving teething powder. Number one, you have not seek the right help. You are using the wrong treatment, and then that is very dangerous. So please, if your child is ill, don't make assumption of the cause. Let the doctors be the one to do that. You just take the child and get the right help. Thank you. Rachel, you started a question, but your question is incomplete. Okay, I think you've completed it now. You said, my child is 8 months old and 2 weeks, and she doesn't have, it has disappeared though. That's why I like people like for me joining me on Instagram. Okay, she doesn't have teeth at 8 months. So yes, there's no need for you to worry if your baby doesn't have teeth at 8 months old. I always joke that you've never seen a toothless somebody that never had teeth in their lifetime. So just relax. Some children may not have their first set of teeth until they are 1 year old. Some people even until 13 months old. So, but it's normal. So everything is arranged. You must always know that everything in life is arranged. So we will not worry if your baby doesn't have teeth even until 1 year. But of course, the dentist wants you to come and see them at age of 1 year when your baby, whether your baby have teeth or not, see the dentist at 1 year. Then Shedoshin, sorry if I didn't pronounce the name properly. How do I know the difference between diaper rash and nla? I guess that's the Igbo version of Ela, which is the Yoruba version. So
Nla. They call it
How do
nla.
you know the difference? I think you need to be a doctor to know. Okay, but I can give you some clues. Usually, what I always tell parents to do is because you may not be able to know. That's the truth because you are not a doctor. But what you just assume if your baby has rashes in the diaper area, first assume diaper rashes is okay. And what do you need to do? Make sure you change the diaper frequently. Diaper should be changed once they are wet, not when they are soiled. Some people believe that it's only when the diaper has poo inside that you should change it, that urine doesn't matter. No, you need to change diaper when they are wet as well because there is a contact with the urine of the poo that causes the irritation on the skin. Two, please use diaper cream, and diaper cream are barrier cream. They create a gap between the skin and the waste products in the diaper. So don't use powder. Powder is not a barrier product. So many people do a lot of powder in the diaper area. Very wrong thing to do because when you do that, what you are creating is that for me is a chemistry, so you are causing a reaction. So you create a reaction between the urine and the powder to form a paste, and that paste is now what is going to irritate your baby's skin. So, but if you put a diaper cream, it creates a barrier. So the urine does not make direct contact with the skin of the baby. And so diaper cream includes things like pseudo cream, your Vaseline, even oil like olive oil and other, but Vaseline, pseudo cream, zinc oxide, they are very good diaper cream. And don't add powder on top of them. Please don't. And that is what you need to do. So if you do that, most of the diaper rashes will disappear. And you must change your diaper frequently. And when you are home at times, you may just take the diaper off. The baby does not have to be on diaper 24/7. I understand that you may not want them to wet the bed and all that, but once in a while, just let some breeze, some air blow around that area. Then some children are also allergic to some diaper products. So make sure that the diaper is 100% cotton, preferably. Avoid the rubber finishing type because they tend to create some babies are allergic to rubber and they will have rashes of that. So just do all that first. So if you do all that, you are changing your diaper frequently, you are using diaper cream like pseudo cream, zinc oxide and all that, and you are not using powder, you are doing all the right things, and your baby still have rashes in that diaper area, then it's most likely there's an infection. Another thing, sorry, before I go to that, is that you must always wash your hands. So the fact that you are changing diapers does not mean you should use dirty hands. You must wash your hands before and after because your hands can also introduce germs in that area. So that's what you need to do. So if you are doing all that and the diaper area is still not, rashes are not going, then it's most likely it is more than, it's not a diaper rash. In other words, it's not caused by nappies. You can have rashes the same way you have rashes in other parts of the body. You can have it in the diaper area itself. So you can have them as bacteria, you can have them as fungal. The fungal ones tend to be very red and very angry looking red and all that. Usually those are for like candida infection. So if you see those kind of type, you may just as well just go through to your doctors for treatment. Or if it's like a pus, like it's bringing out pus, most likely that is a bacterial one, then that also require treatment with appropriate antimicrobial, whether it's antibiotics or antifungal. So you really need to see your doctor. So that is my usual approach for parents. So assume diaper rash first, do the necessary things for diaper. Usually if you do the necessary for diaper rash, the irritation goes away and the rash is just clear. It doesn't require anything. But if you don't do it on time again, the initial diaper rash can also become secondary infected with bacteria or fungal infection, and then that will require treatment by a doctor. So I hope Shendoshin, I hope that is helpful. All right, let me know if you want more information. All right, then postpartum essentials. Okay, my baby had ear infection when she was 2 months, and the pediatrician said it was because I laid him down to breastfeed, blah, 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 blah. Okay, so for me, it is not necessarily true. Your baby can have an infection, but if you are breastfeeding, like I said, if you don't know how to do it properly, don't do it. If you don't know how to do lying down to breastfeed, but if you can go and Google this information online. It's been proven that lying down to breastfeed does not cause ear infection. So of course, some people always have some beliefs, but for me, I believe in what we call evidence-based medicine. So you have to have evidence to say this causes, this doesn't cause. And a lot of mothers breastfeed lying down and the babies don't have ear infection. All right, thank you, Annie Adeswa. Okay, for me, are you also on Instagram? Do you
Yes, I
is it
just
not, do you want to join on Instagram? I don't know whether you can, whether your internet will sustain both. If you want to, then I can have you.
add me on Instagram. I think that will make it faster and easier.
Okay. Lawless is, can a 6 month old use, what can a 6 month use for dry cough? Like we said, I think we've answered the question about cough. We don't usually say use this, use that. We can never even say that. So if your baby has a cough, the question is, what is the cause of the cough? Is the cough due to a viral infection? Is the cough due to pneumonia? Is the cough due to asthma? Is the cough due to a child having a cardiac problem? So the way doctors treat, many people ask person like, I have this, what do I use? No, it doesn't work that way. We don't just say you have this, what do you use? We need to know, why are you having this? That is what we need to treat, because cough can be due to, let's say, 50 things. So the question the doctor wants to often know is that which of the 50 causes of cough is the cause in your own case. So, for example, if your baby has a cough due to viral infection and I'm giving you antibiotics, it's a waste of resources, it's a waste of antibiotics, because your baby is not going to respond to that. If your baby is coughing because of asthma and I'm giving you only antibiotics, just is not going to get better. So what the doctors first want to know is, why is your child having this rash? Why is your child having this cough? And we can't answer that by you just saying, I have cough. That is why doctors ask you 100 questions and you wonder, what is the relevance of this question to my baby having cough? Because that is how we know which one your baby has. Sometimes we have to listen to your baby's chest. So if I listen to your baby's chest, your baby, if I'm hearing a wheeze, then I know, oh, this is most likely an asthma. If I'm hearing some what we call crepitations, then I say, oh, this is most likely pneumonia. So that is how we do. That's how medical process go. We are not like Babalawo. We don't use oracles to know what is wrong, and we need to know what is wrong to know what to treat. So if you go to hospital and just say this is what is wrong, they don't ask you any question and they just write drugs for you. You are seeing a fake doctor, then you should stop going there. That is the truth. So that is how. So usually, like I was saying, the first question that asks, most cough are due to viral infection. We also work on what we call common things occur commonly. What are the things that are likely to going to happen in this age group? So if it's a 6-month-old having cough, no fever, no difficulty with breathing, otherwise healthy child, another, I'm likely going to assume this is a viral infection, because if it's a like bacterial pneumonia, the child will have fever, the child will be very ill. So that's how doctors know what. And if it's a viral infection, your baby doesn't need any treatment. So the most important thing is to prevent it. Exclusive breastfeeding, and your 6 months old should be eating fruits, veggies, avoid smoke, avoid all those things. Those are the things you need to do. You don't need to do anything. But if your baby have fever, fast breathing, difficulty with breathing, then you need to go to the hospital, because that may be pneumonia. And pneumonia kills children. It's one of the childhood killers. So that is why it's important for us to have all the information before we can advise. Okay, let me see. Okay, let me add for me on Instagram. Sorry, where am I now? I would like to, okay, thank you. Yeah, you've answered the question. Yeah. I've had I think that's all the question on Instagram. I hope so. If I miss out your question. Okay, sorry, there's still one more. Any other so I say my baby is 1 year and 2 weeks, but it can't stand or walk. What do I do? Yeah, 1 year, 2 weeks. So usually some babies may not walk until 18 months. So usually if your baby crawling, if your baby is crawling at 1 year, I won't worry about walking or standing. But if your baby is not crawling as well, then definitely you need to come and see one of us, a developmental pediatrician or any pediatrician. But if your baby is not, if your baby is crawling already, but just not able to stand, not able to walk, give her some time. So some babies will not do that until 18 months. But if by 18 months your baby is not able to do is not able to stand, is not able to walk, then you can see a pediatrician. So Rachel is saying, my baby have not started crawling, but you didn't tell me the age of your baby. If you have said it before, I've forgotten, so you need to say it again so that I can remember. Okay, I think I've answered the question about cough. What apps can we use to check with? Just go online, just put baby's heart, baby's weight, whatever. You will see a lot of them. There are so many of them. I've forgotten their names now, but there are many of them. Just go online, you will see all of them there. So just check baby's weight. You can even check it online. So there are many apps, baby monitoring, baby growth, baby growth monitoring or whatever. There are many apps online these days. You can use to check your baby's weight. It's appropriate. Rachel, you need to tell me your age, your baby's age, so that I can advise you as to. For me, I've invited you, but I don't know why I'm not saying you're shy. Okay. All right, let me answer the last question that just popped up.
The invitation expired.
Does developmental delay usually resolve before preschool? No, that is a very wrong assumption. It's very wrong to assume whether a developmental delay is going to resolve or not. It depends on why. So there are people that have developmental delay and it will persist all their lifetime. So it depends on why the child is delayed. So don't make assumptions. If your child is delayed, speech delay or whatever delay, you must see a pediatrician. The child must be assessed. We'll try to find out the cause of the delay. We'll give the child support, speech therapy or whatever therapy the child needs. And then we monitor the child. Even the doctors, we can't tell you what is going to happen sometimes. We never know. We monitor the child. So if we see the child another 6 months and the child has now make more progress, then we are more hopeful. If the child is not making as much progress, then we worry that there may be something going somewhere. So it's very important that any child with developmental delay sees a pediatrician and the therapist and gets support. So don't assume. That's another mistake many mothers make. Oh, the people will tell you, oh, your child is not, don't worry, she will tell. Is it not even this one? You didn't talk on the 3 years. Even I didn't talk on the 5 years. You may not be the same thing with that child. Your own case may be different, but because it looks the same does not mean it's the same. So it's always important that you get the right support first. And please don't allow people to tell you what to do or not to do, because some people are very experienced mother. That's their specialties, to tell people, don't worry, your baby didn't talk. Some of those children may have autism. Some of them may have other developmental issues. So and what we found out is that the earlier the child gets intervention, the better for the child. So don't just sit at home and hoping that things are going to improve. You must seek help. You must seek support first. All right, now let's go back. We'll come back to Instagram. Let's go back to Facebook, then we'll come back to you. Thank you. All right. Okay. So I hope we answer the question.
No, we've not that many.
No, I have to go back up. It's like so many questions have come up.
Okay. On Instagram?
No, on Facebook. Where did we stop?
Okay, no. We stopped at Samuel Chidera's question. So we are taking Stephanie Felix's question now.
Yeah, so let's go to Stephanie. I think Stephanie is the next person.
Yes, she's the next person. Good evening, doctor. My 3-year-old doesn't like to sleep early. She will roll and roll to 10, 11 before sleeping. Should I be worried?
So you need to establish what we call sleep hygiene routine for your baby. Some of us mothers, let me not say some of you, I'm a mother as well. So we leave our babies to sleep on their time. That's not right. You need to set bedtime. There must be what we call bedtime, which means that you work towards like your 2-year-old should be sleeping around 7, 8 max. So you need to start working towards that. There must be dinner time. So you need to give dinner like maybe around 6 p.m. or so. And then you start progressively winding the child down. Because most times the toddlers are very happy. They want to play. If you let them, they fight sleep. They don't want to sleep because they want to play. So you are the one that needs to now put up a routine. So maybe after the dinner, they play a little bit, then there's bath time, there's reading time, so you begin to do activities that kind of wind them down. So you don't do that's not the time for you to go and play heavy music or the time to go and run up and down, all those kind of games. No, it's a time to start winding down. Okay, let's have a bath, let's have a story, bedtime stories, let's have those, no TV, none of those, no tablet. Screen time will further make them not to want to sleep. So you can do that. So if you go on our Facebook group, we have what we call the sleep, there's a booklet on sleep hygiene, how to set up sleep hygiene, sleep routine. Some children, you want the room to be dark. Some children don't like dark, maybe soft lights. You just begin to let them begin to calm down. Let them begin to calm down, and that will help them. But you must, and setting up a routine is not going to happen automatically. You have to do it consistently for over like 2-3 weeks before your routine will be properly set up. So you need to do that. So, but if you do all that and you're still struggling, then you may need to see your pediatrician for support. But most times, if you do that, you'll be fine.
Okay. Certainly you have it there. Kultu Muhammad is asking, good evening, doctor. Please, how can I stop my 5-year-old child from bedwetting?
Okay, so bedwetting, usually we don't even start talking about bedwetting until the child is 5 years old. So your baby is actually just on the cutoff for bedwetting for us to start worrying about it. And there are a lot of strategies you need to do. Number one, you need to make sure they drink a lot of water during the day. That's the opposite of what most parents do. But the children actually need to drink a lot of water during the day. But you now stop it usually at night, maybe by 6 p.m., no more water. Don't give them things like tea, like caffeine and all those things, because it irritates the bladder. And you need to do that. Then you need to help the child to go to toilet, before they go to bed, you tell them to go and wee. And another time before they go to bed, toilet, when you have slept and you are maybe they've slept and you are going to your own bedtime, then you can also let them wee again. And some parents may find it easier to wake up to help them, go to toilet again in the evening, but some parents may not be able to do that. But your baby need to drink at least 6 to 8 cups of water during the daytime. And then, because constipation, that is hard stool, is also one of the major challenges of bedwetting. So the stool has to be stopped, because you see the bladder and the rectum. The rectum is the poo storehouse, while the bladder is the urine, the pee storehouse. So you need to make sure that if there's anything and both of them are like elastic and collapsible. So if there's a lot of things in the rectum where the poo is stored, if there are a lot of poo adds to there, it will push on the bladder, which means that there'll be less space in the bladder, and that means that any little urine in the bladder, it will come out. The baby will not be able to store enough urine in the bladder, because you need your ability not to bedwet means that you can store a large amount of urine till the time that you can wake up to go and empty your bladder. And then some children are very deep sleepers. So some children, they can wake up when they want to wake. Some children are very deep sleeper. So those ones, they may just release. So you forward try some of these strategies. If you go online, you go to what we call, there's a website called ERIC. Just Google bedwetting ERIC. ERIC. If you go to their website, they have a lot of tips for parents on how to handle bedwetting. Sometimes you do all this thing is not helpful, or your baby keep bedwetting because some children produce too much urine, or they don't concentrate urine and all that. So then you may need to see your pediatrician or pediatric nephrologist, and we can support you with other bedwetting alarms, drugs, and all that. But for most 90% of children, when you try some of those strategies I've mentioned, the bedwetting thing will go. And please don't shame the child. Don't scream on them. It is a positive reinforcement. So you want a child to do better, you give them, okay, if you don't bedwet, okay, when the child doesn't wet, you give them a gold star. I'm sure the teachers know how to do that. When you get like 5 gold stars or 7 gold stars, you're going to go, you can buy maybe 1 ice cream or something. You give the child positive motivation. Now's not the time to start shaming them. Sometimes bedwetting is not the child's fault. It's not the child's fault. It's the maturity of that pathway of the brain to the bladder and all that. Some children mature faster, some children mature later. So you need to be patient. You need to encourage them And if you are doing all the right thing, the child is drinking water, the child is not constipated, the child is waking up to wee, and yeah, the child is sick bedwetting, there may be something else going on. Or the child even struggle to keep urine. You know, some children every few minutes they want to go and wee. And it's always like the thing is urgent, like they have to rush. And if they have those kind of issues, that means that there may be more issues going on, and then that is where you need to see a pediatrician for further support in that area. I hope that is helpful.
Okay. Jennifer Ozigbo. Okay, I just want to commend you and your team for a beautiful service you render. I have no questions. I'm just glad to know ATP because whenever I see how my 17-month-old toddler eats and bathes, thanks to your teaching, I was able to achieve this. Jennifer, thank
Thank
you.
you, Jennifer. Thank you for that beautiful feedback. So if you
Thank you
have
for
your
that.
ATP story, it's our ATP anniversary month. So feel free to tell us your story, share it to our Facebook group. We're very happy to read it. Thank you.
Okay. Yeah, and Darlene Ifem is asking again, please, what then do you advise for the cure of jaundice?
Okay, so if your newborn has jaundice, Darlene, jaundice is an emergency in a baby. You must take that baby to see a pediatrician. You must take that baby to see a pediatrician because jaundice can cause brain damage. Now, 60% of babies will have jaundice. If your baby is preterm, 80% of preterm babies will have jaundice, which means that jaundice is very common. Now, majority of babies that have jaundice have what we call physiological jaundice. In other words, you don't need to treat it, it's going to go by itself and it doesn't require any treatment. But some babies have jaundice that we call pathological jaundice. They are jaundice due to certain medical condition, whether the baby was born premature or infection or G6PD deficiency or ABO incompatibility. If you are blood group O and your baby is A or B, your baby could have jaundice or resource incompatibility. So now you as a mother, you will not know. Even me as a pediatrician, I will not know when I say baby that this baby is having physiological jaundice or this baby is having pathological jaundice. There's no way I'm going to know by looking at the baby. So we need to take the baby's blood first. We will have to take that baby's blood to know what is the level of the jaundice. So when we know the level of jaundice, so if we say, oh, this level, there's a level for different days, different age of the baby. It's a low level jaundice, we'll say, okay, maybe it's physiological jaundice because we know what is there's a level, there's a way we characterize neonatal jaundice. If you go to our website, www.askthepediatricians.com, there are 2 articles there on neonatal jaundice. You can go and read it after this program so you understand all this. I'm saying you can read it in details. So number one, we need to know the level of jaundice. Is it a high level or is it a low level? There's a level of jaundice we'll tell you, go home, just go and breastfeed, don't need to do anything. There's a level of jaundice we will do, we will have to change that baby's blood straight away. If I mix a baby and your baby's blood level is a term baby and your baby's blood level is 20, we have to change that baby's blood because we are racing against a jaundice permanently damaging that baby's brain. So if it is not so high like that level, that is the extreme. There's a level we just put the baby under what we call phototherapy lights. So that is what we do. So when your baby has jaundice, any baby that has jaundice must see a pediatrician, must do blood tests. There is no way you can treat jaundice without doing these things. Many people will just say, stay at home, give pawpaw water, give
Put on that sunlight.
put under sunlight. Many of you are getting away with it because majority of those babies don't even have pathological jaundice. They just have normal jaundice. But some of your own babies have pathological jaundice. So most of the time, because I'm a developmental pediatrician, I end up seeing those babies. And mothers will say, oh, they are waiting to do naming ceremony. Your baby has jaundice. You are waiting for naming ceremony. Please don't. If your baby, in fact, some of us, we don't discharge your babies home. When I was in Luz, we don't discharge babies home until the 3rd day. Reason is because we are looking for the jaundice, and you see us putting your baby under natural light because sometimes your artificial lights can deceive you. You may not see jaundice. So we look at the baby, and some people say, "Oh, it is the clothes. It's the yellow clothes." It's not the yellow clothes. So yellow clothes does not cause jaundice. So we need to check. And when we check, even as a pediatrician, we still take blood we will have to take the blood and do the blood test. If it is now low level, we'll send you home and we check it again because jaundice can rise. It can be normal one day and rise the next 2 days. So we normally check it again. If it sometimes it goes up before it will come down. So if it is going up, but it's not yet above the physiological level, we'll still not do anything. But if it's above the physiological level, we admit your baby, we put your baby under phototherapy light. Some babies, if it is too high, we change the blood. We take away all that blood with all the jaundice inside and put in fresh blood without jaundice. And we still put the baby under the phototherapy light. So maybe it's like what we call conjugated jaundice. That one may not need phototherapy light. It can be due to infection and we need to treat. Some babies have the kind of jaundice that require operation. If there's a block in the what we call the gallbladder or the biliary system, if there's a block somewhere, we may need to do an operation on the baby. So there are many kind of jaundice. There are many causes of jaundice, and the treatment depends on the type of jaundice. This is not something parents can do. It's a pediatrician's job to do that. So when your baby has jaundice, go to the hospital. Don't follow all those mamas at home. All their
I gave my baby papa water.
Don't follow them. Don't follow them. Many babies are having cerebral palsy today. Many of them have lifelong disability from jaundice. If you have listened to the radio, there was time in the BBC and UNICEF, they were making a lot of jingles about jaundice. Jaundice can cause brain damage. So for me, I always tell people that jaundice is an emergency. And sometimes you come too late, we will change the blood, but the damage is done. And then the baby will have cerebral palsy, the baby may have deafness, baby may have other issues. So learning difficulties in future. So we don't want to joke with the baby's brain when it comes to jaundice. So it is not that the jaundice will clear. Most people think the jaundice will clear. Yeah, jaundice will even clear. You don't need to treat the jaundice. The jaundice will clear. Whether you treat it or not, it's going to go. That is the truth. But the problem is that before the jaundice has gone, what damage has it caused? So that is why people don't get it. So the jaundice clearing is not the issue here. The issue is what brain damage has happened before the jaundice go away. So please, I don't know how old your baby is and the lane, but please, this baby needs to be with a pediatrician now. Like now. Thank you. All right, let's move on.
Okay. Jennifer Ozigbo. Doctor, please, my 17-month-old uses his potty as a cup. When I make him sit on it and make the pee sound, he just laughs and stands up. How do we go about this potty training?
Okay, thank you so much. That's a very lovely question. There's nothing wrong with your baby. That's a perfect child who is just playing because a potty looks like a cap, so why not put it on your head? So your baby has to be ready before you can potty train them. So this child is showing you a sign of it's not yet ready for potty training. So there are signs we watch out for. Most children are not ready before 18 months. That's the truth. I know Nigerian mothers always want to pride themselves that my baby, I started potty training him at 8 months, 6 months. I started potty training at 1 year. Most of those things, they don't give a word for it. So your baby has to be ready for potty training. So what are the signs that your baby is ready for potty training? Your baby can show you signs that they want to wee. If your baby is not yet showing you signs that they want to wee, they are not yet ready. What signs do they show? So if you are using them diaper, the child may begin to take it off by themselves. When they are taking it off, that child is showing you sign. So you know the sign of a child who wants to wee, or the child will come to you. They give you other signs. Mothers, all these things I'm talking about. The child is able to sit on that potty. So those are the signs. So the child sitting on the potty should be something. The child can walk. The child must be able to walk to the potty, but be able to sit on it. Must be able to take off his pants or diaper. Those are the signs that your child is ready for potty training. And then you give them that time. You stay with them and do. Usually what we normally do is to make the children sit on the potty like every 2 hours. Whether they want to do anything or not, whether they do anything or not, let them just sit on it. Let them just be comfortable sitting on it. And then you can show them nice pictures or videos. There are many apps these days on potty training, and they will see other children. Like if it's a boy, you show them video of other children pee inside the WC and all that. The child will also like, oh, me too, I want to do that. Or you can show them other children sitting on the potty. Children like to copy other children. So those are the things you'll be showing them. You can read books about them, and then you also dictate that time to. Usually it's better when you yourself have time. maybe you're on leave and all that, and you potty train. Some schools or nursery also help with that process. So if your child is not ready, there's no point forcing them. So you just wait until they are ready. If you also go to our website, we have a lovely article on potty training that you can read and follow. Okay, our time is running out. Let's go faster.
Okay, my baby is yes, my baby is 14 months and have serious catarrh and cough. He coughs more at night.
You should take the child to the hospital. If your baby has serious catarrh and cough, you need to go to the hospital. Yeah. So I'm using your word because it's what you told me. Serious. If it's serious, yeah, that's an hospital treatment. The doctor needs to see the child here.
Okay, the next question. I'm a breastfeeding mother. My baby is 2 months. I'm on exclusive breastfeeding. Drinking tea makes me gas too much and is affecting my baby to gas too. What should I do?
No, I think you missed out the question of Augustina Hotega. Augustina said my baby is 7 months old. And
If I sit in, he can sit and move with bum bum. Please, when is the right time for babies to sit by themselves?
babies can sit by themselves from 7 to 8 months. Your baby is already sitting by himself. So why are you worried about it? Are you worried that your baby is doing it too early or what? Because your baby is already sitting and moving with his bum. That is even advanced level already. So I don't know. Maybe you need to tell us why you're asking the question. I always like to know what you're asking so that I can make sure giving you the right answer. Because your baby is already sitting. So why do you want to know what's the right time? Are you worried that your baby should not be sitting yet? So most babies start to sit between 5 to 6 months, and they can sit very well by 7 to 8 months. That's the answer to that question.
Okay, I'm a breastfeeding mother. My baby is 2 months. I'm on exclusive breastfeeding. Drinking tea makes me gas too much and is affecting my baby to gas too. What should I do?
Stop drinking tea. Simple. Drink water. You don't need to drink tea. Those are very straightforward. You know this cause, then you know the solution. Just stop drinking tea. I don't know. I mean, anybody said that you must always drink tea because you're breastfeeding? You don't. Just drink water and eat normally. That's all. Okay. Good evening. Okay. Thank you.
Okay.
Let's move
Okay,
fast.
please, I really need advice on this. My baby is 12 months and 2 months old, but he doesn't like eating at all right from infant. Did exclusive for him and thought after the 6 months it would change. While I got work, gave him multivitamins prescribed by the doctor, but still no improvement at all. That I had to introduce breastfeeding like the Yoruba style. And sincerely, I don't like it, but that's the only way I can give him. Try different kinds of food just to detect what he might want, but still no improvement.
Your even Facebook has cut off your the rest of your question. Okay, so you number one, don't force feed your child. Please don't. You can kill the child. I'm not joking. Please stop. I mean,
Yeah.
you just read the news. I think it wasn't not recently a 71-year-old woman was jailed in the US for 15 years
Good. Yeah.
because she force fed the baby and the baby died. And I have seen baby died from force feeding because what you are doing basically is that you are pouring the whole food. You can pour it down into the lungs, and that is the end of it. Please don't force feed your child. What you need to have is the right information, the right knowledge of how to go about complementary feeding. And I'm not going to answer that fully here because I can sit you for a whole hour to do that. So from our Facebook group because I can see from where you. So just copy this question and put it on the Facebook group as well, so that somebody will link you to the guide section. You need to just relax first because I can see you are really worried and you are anxious, and it's because you need to be patient. Some of you, the way we go about the complementary feeding, because you did your exclusive breastfeeding and it was nice, but when you time for complementary feeding, you need to follow the guidelines. By the time we talk one-on-one, I see that many of you are not following the proper way to do it, and that is why you're struggling. And when you're introducing new food, you have to be patient. You don't just start one food today, and because maybe they didn't hit it today, then you say maybe has rejected that one, and you start going to another one. And force feeding doesn't make the child to eat; it actually make them eat food the more, because you are making them look at food as a pain instead of something they should enjoy doing. So, but if you really need to watch all the complementary feeding videos, you need to sit down and just relax first and then follow it. multivitamins is not the solution to a child who's not eating. I don't know where we learned that life from, because all of you will say, "Oh, my baby is not eating. Just give me multivitamin." Multivitamin is not going to make your baby eat. That is wrong assumption. What you need is knowledge and appropriate way to go about feeding your baby, and you can still do it. But please, first stop that. Stop the force feeding before we have
Breastfeeding.
another story. So let's go. So, but please post your question on our Facebook group so that somebody
And
will leave the guide section, and you can go to the guide section. You can watch the videos, follow it, be patient. Don't just like be too like it's not going to work. I've tried everything. No, most time when people tell me I've tried everything, just relax and start all over again, and you'll be surprised. Some of us you don't offer the food long enough. You give it one day, then you quickly. Some people within 1 month they've tried all the food, and I'm like, it's not possible because you're not supposed to even try more than one new food in a week. So there's no way you could have tried all the one food in 1 month. So you need to be patient and you need to follow guidelines. If you do it properly, I think somebody just gave that testimony now. Those who read the principles and followed it, they are happy because they can see that it helps their children eat. So at least you can scroll up, you will see that comment. So that tells you it's possible. Just relax and follow the guidelines and it'll be helpful. But stop force feeding though, because that may be it may not end well.
Okay. Elliot, please, is there any food a breastfeeding mother will take and the baby will react to it? Example, garlic, zobo, and the rest, and some sugars too. Baby is 3 months.
Your baby can react to anything. So what you need to know is to now be vigilant. If you are giving your baby anything and your baby reacts to it, then stop it. That is it. And most of the time, for your baby to react to something, you too will likely react to it. There's a way mothers and children are connected that way. But if you take any food and you notice that when you take that food and your baby starts showing signs, just stop it. You will know that it has to do with this particular. Whenever I take soap or whenever I eat beans or whenever I eat this garlic or whatever, then stop. So I usually tell parents avoid unnecessary flavors and all this. Just eat your normal edible food that you've been eating very well. Most of those reaction has to do with all those extra flavors and stuff or supplement that some of us are taking. Just take them off and just eat. Like the other person that said, when I take tea, my baby gas a lot, then just stop drinking tea. If you take sobo or you take a particular food or you had ginger or garlic or whatever, and your baby start having reaction, just stop it. It's a very simple and straightforward thing. Okay, all right. Should we go to?
Okay, good evening, ma'am.
Okay, let's take that question, then we can go to
We
Instagram.
have like 2 more minutes.
Yeah, our time is gone. We just try and round up the questions that have come in before 7, and then all the ones that come after 7, please, you have to put it in our Facebook group. Yes, I always try to take the ones that have come in during the night.
Okay, good evening, ma'am. My 3-year-old weight is 11. Should I be worried? You don't know
No,
this.
it's fine. It's fine. Most babies weigh 12 kilos, but 11 is still okay. So don't need to worry. Let's proceed. Who is this question? Anjorin. But what was the first question you had? So when you asked me a second question, we can't remember what you asked before. So what's the age of your baby? And just let us know because we can't remember. Do you remember what Anjorin asked before?
No. I tried scrolling up to look for it.
I don't even think you even put your first part of your question online. So we can't even see your first part.
No,
we
the
just
first
say
part is not there.
you weigh 8 kilos. You need to tell us the age of your baby and the weight for it to make sense to us. All right, let's move on.
Okay. Good evening, doctor. Please, my 23-month-old toddler is too clingy. What can I do?
Clingy, yeah, babies can be clingy. There's nothing wrong with that. So I don't know what you mean by definition of too clingy, but some of you also cause it by the fact that when your baby were younger, you are always the only one carrying them. You are the only one doing everything for them, and so the baby has realized that you are the only person. So the way to remove it is to gradually increase the gap in between you doing everything for the child. Of course, there's going to be a lot of wailing and crying because it's never going to be easy. But after a while, the baby will get used to it. So we have, I think there's a if you post on our Facebook group, there's there's a write-up that I put before on how to undo separation anxiety and all that. So you have to read it up, and you may find some tips on that. But basically, it's just to gradually let go. It's never going to be easy. Just take note of that, but it can be done. So just exercise. Okay, Anjari Tilokpa. I don't know who is asking. Anjari Tilokpa. I don't know what
Please send it.
I think one of our moderators
Okay.
is that.
I don't think so because the name is not there. Please, an infant weighing 8.5 kg at 8 months, 14 days, and birth weight is 4 kg. Is it okay?
It's still okay. It's not so bad. Um, yeah, yeah. Maybe it should be closer. Yeah, 8.5 is not bad for a 8-month-old. No worry.
Okay, hello doctor. I want to know if it's normal for a baby to have tiny limbs. Mine are not quite or not full quite alright, but I feel as a growing up baby, she should have full hands and legs like other babies. Then maybe later in life, her legs can take their form. Her weight is normal because at 5 months, she has almost doubled her weight, her birth weight.
I'm not really sure I understand what you mean by small limbs and full limbs and all that. So the best option is for you to let this baby be examined by a doctor, because usually when mothers are saying things, we like to say, "I'm happy that your baby's weight is fine," which is actually which is reassuring to me that your baby is okay. But sometimes parents have expectations that this is what it should look like. It may not necessarily be correct, and there may be actually nothing wrong with the baby's hand or legs, but some babies can also have some medical conditions that make their body proportion not to be, the right proportion, like children that are going to be short or things like that. So, but I'm not even sure I get what you're trying to ask. So it's better you let us examine your baby, or you can send us a video of the baby if you don't mind, and so we can look at the hands and the legs you are talking about, and then we can advise you. All right, let me quickly go to Instagram and round up
Instagram.
on Instagram, then we'll round up on Facebook. I hope I remember where I stopped. Oh my goodness, I can't remember where I stopped on Instagram. Okay. Yeah, okay, I remember now. Rachel, you are the one asking your question. Your 8-month-old baby is not yet crawling. I will not worry about that. Usually most babies crawl at 9 months. So it's too early to be worried about an 8-month-old not crawling anyway. So, and usually I wouldn't even worry if the baby is not crawling until 1 year. So there's no reason for you to worry. All right. Rachel, okay, I think yeah, so I remember where I stopped. So Ghana was where I stopped about developmental delay and it resolving. So Ayola Wale is saying, what's the cause of teeth grinding when sleeping in children? Lovely question. So some children grind their teeth as an habit, what the dentists will call bruxism. Some children actually grind their teeth as a form of what we call subtle seizures, like a convulsion, but it's a mild one. So I would recommend you see a dentist first. And if the dentist don't think it's an habit, then you may want to see a pediatrician. So we need to know which one it is. If your child also has other neurological issues, I will worry more about seizures and all that. So, but sometimes it's just an habit, but it's not a good habit because it wears their teeth out, and the dentists have their small strategies that they can give to you to deal with it. Now, Titi Lowola said, my baby weight is 2.7 at birth. Now, 8.5.8 is the weight okay? But you didn't tell me the age of your baby now, so I'm not going to know whether it is okay or not. So whenever you ask a pediatrician a question, the first thing the pediatrician needs to know is the age of the baby, because we see children from 0 to 18 months, 18 years, and they are not the same. So a newborn baby is not like an 18-year-old child. So adolescent. So I really need to know the age for me to be able to comment on that. Sorry. So you need to ask that question again. Hopefully, we can still take it before today. If not, post it on our Facebook group and we can take it from there. Adolescent heads up. Thank you for joining us. Rachel. Okay, Rachel, you've asked a question like 3-4 times. Don't worry, I've answered. Just relax. Just relax. Your baby is fine. There's nothing wrong with your baby not walking and not crawling at 8 months. I'm not worried at all. I'm not even worried if your baby is not crawling at 9 months. I will start worrying when your baby is not crawling at 1 year, because that is when I will not think it has been delayed. All right. Tisilola. Oh, your baby is now okay. Tisilola has now told me the age of the baby. My baby is 4 months old. Um, what did you say was the weight again? Because I have to see, that's why you have to put your questions together, because I have to now scroll up to look for the to look for it. 5.8. Okay, at 4 months. 5.8 at 4 months is not bad. Yeah, that's okay. No need to worry. But I've talked a lot about how to know your baby's weight is appropriate. Okay, maybe it's 3 months, 10 days. He has sudden rashes on his cheek. What are the first signs of milk reaction? Why should your baby have milk reaction? Your baby should not have milk reaction. Your baby not on breast milk. So if your baby has been taking breast milk, your baby should not react to it at 3 months. Baby has taken it for 3 months. So, but if you are giving formula, very likely your baby is going to have a reaction. Baby would have had a reaction a long time ago. So there are many other reasons why a baby should have rashes. So we need to see the rashes first. We can have rashes from the products you are using, from the soap, from drugs, from what you are eating yourself. So many possibilities. So it's better. Don't always make assumptions of what is causing something. It's better you let the professional do that, because the reason I always make that one is because it kind of tilts you towards doing certain things and you may actually not be right. And so it's better not to, it's better to have an open mind and let the professional be the one telling you what it is. And I won't be able to tell you what it is unless I see the rash myself. So I can't even me as a professional, I cannot jump to a conclusion that your baby is having milk reaction when there are like 1,001 questions I'm going to ask you before I can even say it is a milk reaction. For example, is it breast milk or formula? What kind of milk? Did you just change the milk? So why is the baby just reacting now? All right. Ugona is saying, what type of fish is best for children? All the fish are best. All the fishes in the sea are okay. Of course, there are some fishes that have what we call DHA, like sardine and all salmon. They have extra DHA, but all the fishes have protein, and all your children needs protein. So as long as baby is happy to eat the fish, you should give them. There's no issues with fish. So, and you got that because you've asked a question before. I'm making a connection. Sorry if that is not an appropriate connection to make. But please, if your child has developmental issues, don't just go and be doing supplements. Don't just think giving them fishes or fish oil or all those is going to take it away. It is not going to do that. So that child needs to see a specialist. That child needs to get the right therapy. Giving all those supplements are okay for brain development generally. It's just like general development, but it doesn't take away a child who has a difficulty. That child needs to get appropriate evaluation and appropriate intervention. I think it's very important that I see stress the house. TYT cakes, my baby is 2 years old, but whenever I want to pull, it touches his bum and cry. Is a pull hard? So it's possible maybe have constipation. Your baby is having constipation. You need to make sure your baby drinks a lot of water. Your baby takes fruits. Your baby takes vegetables. The stool must be soft, and at least they should open their bowel once a day or every other day. So those are the things you need to work out. Most of these things we give children, all these biscuits, pastries, and all that. All this junk food, they make them constipated. So they do, and that's why they will have hard stool. So, but you must make sure that they take vegetables, fruits, lots of water. But if the baby is already constipated, you may sometimes need to see a pediatrician, because you may need to give them something to soften the stool to bring it out first. After that, then you can now go on making sure that there's prevention and all that. Titi Lola, my baby is 4 months. Okay, yeah, I've answered your question now. Thank you. All right. Okay, finally. So last 6 months, your week should be about 2 times. Okay, I can see some Ethiopians already helping me out with my question answering. Thank you, Udupe, for Larry. Yeah, that's a very right information. Thank you. All right. Ozzy said, why every time I feed my baby, it speeds up a lot, even after popping. What is the age of your baby? You need to always tell me the age of your baby. And if vomits, so your baby should not be vomiting. Baby can speed up, they can what we call a reflux, but they should not be vomiting. All right, so I hope that makes sense. Sika is saying, my toddler boy of 23 months is not talking. What do? You need to see a speech therapy. you need to speak. If your 2-year-old is not talking, you must see speech therapy. Yeah. Okay, I think I've answered all the questions on Instagram, hopefully. Okay, TYT said the stool is soft. If the stool is soft and your baby is just touching the bum and cries, then there's something going on. Is there a wound there? Is there something there? There's something making the child to cry. So we need to know why. So that's important. So I'm thinking, why should the baby cry when a 2-year-old is old enough to know? If it's a baby now, I won't. If it's like a newborn or less than 1 year old, maybe, but a 2-year-old, yeah. So if they're crying when trying to pass to, if there's a wound, you need to make sure you sort it out and all that. Yes, thank you, Ngozi. All right. Okay, so let's quickly round up on. I hope Instagram, thank you so much. Just keep joining, just keep listening to the rest of it, and then we'll finish. All right.
Okay. No.
Okay, answer that one. Okay.
Yeah, my 1 year 4 months old toddler has been stooling for 3 months now. I did stool tests and she was positive for occult blood, but no pathogen in stool or any disease. What could be wrong with her?
So stooling, for when you say stooling, you mean watery stool, diarrhea? I guess that's what you meant. For 3 months, there's something definitely going on. So obviously you've seen a doctor because you are talking about stool for alcohol blood, blah blah blah. You've done stool culture, so it is your doctor that can answer that question, because I believe they've asked you lots of questions which you have not told me the answer to now. And so there are many reasons why your baby should have chronic diarrhea. So you may need to see a pediatrician. I don't know who you have seen. If you have not seen a pediatrician, you need to see one, because there are other things we need to now know. Why is the baby having? But your baby also have blood in the stool. You said the stool for alcohol blood is positive. Yeah. So why is there blood in the stool? So there are many things to. You can just ask a question like that on the kind of a platform like this, because we can't do a lot of back and forth, and there's no way I will know what is wrong. But there's something going on if a baby is having chronic diarrhea. It doesn't have to be infection. That's why you've only done the test for infection, but there are other things that will cause chronic diarrhea apart from infection. So that is what your doctor should be looking at and be telling you, and all that. Even some babies have what we call like food intolerance, food allergies. Different things. Some children have some what we call digestive enzymes. Maybe they have a deficiency. So there are many possibilities. I don't even want to go into all that, but just for you to know that there are other things that will cause chronic diarrhea beyond infections in a baby. So that's just what I will say.
Okay.
Okay, I think it's also the same person as TYT cake. So because this question I've answered it already, so let's just move on. Okay. Yeah.
My 2 years 2 months daughter talks when she wants to pee, but keeps mute and pulls anywhere she sees. She talks very well. Please, should I be worried? Secondly, when does developmental delay manifest?
Okay. Yeah, thank you. So I will be worried if your 2-year-old is pooing everywhere, because that is an habit. Because she definitely knows how to talk, and she can tell you she wants to poo or pee. And so if she's doing that, that's a habit that we need to watch. So you can, if she's toilet trained, that's another question I want to ask. Is she toilet trained first? Let's start from there. And so you may want to make sure you get the toilet training properly done. And, but some children do that as a result of another developmental disorder. For example, for children on the autism spectrum, it's one of the things they can do as well. So you may want to see. So when you say developmental delay can start at any age. What it basically means that if we expect a child to be doing something and the child is not yet doing it, then the child is delayed. And it doesn't have to be, it can be in any area. It can be what we call isolated delay. Like, for example, maybe all the other areas are fine. Maybe it's only the speech, or maybe it's only the walking. So all the other one may be fine. So that is isolated. But it can also be global. In other words, the child is delayed in all the domains of development. Maybe what we call gross motor, the walking, the running, and all the speech, language, or it could be self-help skill, like doing things for ourselves. So if you have more than 2 areas delayed, then we call it global. If it is only one, then we call it isolated delay in that particular area. So you need to give us more information to tell you one, but it can start. For example, if a 3-month-old let me not say 3 months. If a 4 month old does not have neck control, that is already a delay. So you can start as early as that. Or if the child is not having social smile at 4 months old, that is a delay. So it depends. So if you have concern there's a delay somewhere, you need to see a pediatrician for proper yeah, somebody is recommending something. It's fine. Okay, thank you.
I love you, Mother. Bless you. Okay, thank you for that. Okay,
Uh,
Angela is okay. My baby is 12 months and 2 months. He weighs 8 kg. I asked earlier about baby not eating.
what do you mean 12 months and 2 months? I mean, am I confused? Do you want to say baby is 14 months old? Because because you said 12 months and 2 months.
So,
Are you asking about two children? One is 12 months, one is 2 months old. Okay, let me assume you mean 14 months, which is what I'm going to assume now.
14 months.
And weighing 8 kilos, your baby is like on the lowest line. When we say something is normal, then you have what we call the lower limits of normal, and you have the upper limits of normal. Your baby is on the lowest limits of the normal. So the 8 kg is still, it's okay, but we are worried now because if your baby drops lower than that 8 kg or remains at 8 kg while the weight is going, while the age is going up, then there's a problem because that means child is going to underweight. So I don't know whether we've answered your part of the question about baby. Are you the one force feeding the baby? I'm not so sure. Maybe. No, I don't think she's the one. She's the one force feeding. No, she's not the one. That person's a Facebook user. I can't remember what you asked about feeding earlier because we can't say. Maybe it didn't drop.
I question. She didn't complete the question. The question was incomplete earlier on.
Okay, maybe you should just kindly put that question on the Facebook group. But I think we've answered a lot of questions about people eating or eating. I think you can follow that advice, but just put it on our Facebook group and somebody will show you our guide section. So if you go to our Facebook group, we have a lovely segment called guides. So it has a lot of detailed information. So there's one on complementary feeding. It has a lot of videos for you to watch. I love those videos because they did them using African mothers, using local food, because I want you for you to understand that feeding your baby doesn't require breaking the bank. It doesn't require you going to the shop at all. You can feed your baby with what you have in your kitchen. Of course, like somebody asked me last week about whether it's a Maggi and the other things in your kitchen. No, of course, I'm talking about real food. The same food you eat, you can feed your babies with them as well. So just go to our Facebook group and you will be directed to that area. Okay, let's round up now. Fumi, do you want to read this question?
At what month will baby's words be understandable?
Baby's words can be understandable from age of 1 year. So the words that's like mama, baba, they start saying that from age of 1 year. So a 1 year old baby should have like this 1 to 3 clear words. 1 to 3 clear words. So that's that. I hope that's helpful. Ilori.
Good evening, ma'am. My baby of 4 years, 4 months has hole in his tooth. We have seen the dentist, but the pains kept coming. How do I help him?
You have to go back to the dentist, unfortunately. Did the dentist give you painkillers? They should have given you painkillers. So have they filled the hole? Because you didn't tell us, you just said you've seen the dentist, but you didn't tell me what the dentist did. So I won't know whether the dentist has solved the problem or not. But since you have seen the dentist, which is the right thing to do, if there's no improvement, then you have to go back to the dentist and let the dentist know that we are still in pain. No. So usually I would say from a pediatrician perspective, give painkillers, paracetamol, or any of the ibuprofen that can be helpful, but you still need to see the dentist and they may decide whether they want to take off the tooth or whether they want to fill it or whatever they want to do. Usually at this age, 4 years, 4 months, because maybe still have mixed teeth. So the teeth most likely will still have to be removed anyway because the new teeth will still eventually come out. So, but I think you should see the dentist, all right? Thank you, Lorita. Oh, somebody is watching from YouTube. Finally, thank you. At least thank you that somebody logged in from YouTube. I'm so grateful for that. Thank you. All right. Yeah. So
baby is 14 months. I think you sit on the 14.
You don't need to worry. Your baby is not ready for potty training. So I have told you, babies have to be ready for potty training. Don't force them. Some things are not when it comes to development. I know mothers like things early, you like things sharp sharp, but some things you can't force it. You have to wait for the child to be ready, and one of them is potty training. Some children are early, fine, just like every other thing else. Some children are not ready on time, so just let them be. When your baby is ready to sit, when your baby is ready for potty training, baby will sit on the potty. But you can start showing the child videos of potty training, of other children sitting on the potty. Make it interesting. Buy the potty of cartoon character that the baby likes. Make it love. Make it something the child will be interested in. That's what I'm going to say about that. Final question. We go on. Okay. This person is. Uh, okay. Yeah. So
Okay,
the okay
Paediatrician, they gave
feedback.
us painkiller but refused them from filling it. It was trying so they could not refill it.
Sorry about that. So you have to still go back to the dentist. I mean, I'm even surprised. 4 year old. I mean, baby still a tooth. It's a baby teeth. Okay, thank you so much. Thank you, everyone. I think we're going to stop it there. Ozzy was giving me additional information based on your baby is on breast milk and formula. Yeah, we recommend that you exclusive breastfeed your babies. It will reduce all those rashes, all those allergies, and all that. But I still can't say it is the formula because I don't know whether it's something new, unless the formula is really new to the baby. And then for how many times your baby should pass through every day can vary. It varies from some babies don't pass stool every day. Some babies may not pass stool for 2 weeks if they're on exclusive breastfeeding, but some babies can pass stool up to 12 times a day as well, and it's still normal. So it's a range. So it can vary from none to 12. So that's it. All right. Thank you so much, everyone, for watching on
Okay.
Facebook, on Instagram, on YouTube. Everybody that watched today, we appreciate you. Fumi, you want to say something? Okay, I thought you were saying something.
Okay. Yeah, I just want to remind our viewers that it's our anniversary week. So you can actually congratulate us by donating to Ask the Pediatricians Foundation. You can get our account number. You can request for it, and you can also find them on our Facebook group. We don't mind the no amount to too small, 1,000, $2,000, pounds, anything. But we'd like to say a very big thank you for all your support in the past years, and we hope to do more in the coming years. Thank you, and have a pleasant evening.
Thank you so much. So for those on Instagram, I'm not sure you heard from me very well. So it's our anniversary month. We're celebrating 6 years of impact, and I think we're launching our podcast as well as part of adding value, more value to you and to your children. Remember, we are committed to the well-being of your children. We're looking forward to that day where no child in Nigeria, in Ghana, in Africa, and all over the world will die from something that we can prevent. And that is our dream as and vision at ATP. And we do it online through all this kind of platform. If you want to ask questions outside this 1 hour of our online ATP Live, you can post all your questions on our Facebook group from Mondays to Saturdays, 24 hours. We are always there answering your question. We take a day off on Sunday, and you can post your question there and we will answer you. And of course, we have our website. You can read a lot of topics. Our app is we are upgrading it, so you may not be able to access the app for now, but we are hoping to also put in a podcast app as well. And then we also have our YouTube channel where you can rewatch. So if you have missed any of this ATP Live, it's always available on our Facebook page. It's available on our Facebook group. It's available on our YouTube channel. So you can read it. And if you still have questions, post it on our Facebook group. You can also send us your questions. Usually we don't do email anymore, but you can put it as anonymous on our Facebook group and we'll respond to it as well. So thank you so much, everyone who has joined us today. We appreciate you. Keep taking care of those babies. Keep keeping them healthy. And we will see you once again next week, Monday, God willing. Bye.
Next.
Bye-bye, everybody. We're going off now.
Bye bye.